Good morning, medical skills. We are going to cover the temperature, pulse, and respiration lecture. Give me just 1 second. Let me put the PowerPoint up. So we'll start measuring. We're going to start covering the vital signs and the other clinicals. For this lecture, we're just going to cover temperature, pulse, and respiration. Blood pressure and other skills we'll cover a little bit later. Hopefully I'll be in the classroom and we'll be doing this together. Um, Temperature, pulse, and respiration. Okay. So those are your basic vital signs. Vital signs are monitored at prescribed time for the hospitalized patient. The frequency of these measurements increase with any change in the patient's physical condition or whenever there's an invasive procedure is performed. So basically, we want to have a baseline. We want to know what the patient is normal. So if a patient is normally at a certain set numbers, we want to record those before we have any major changes. And that way we have a comparison. I've had patients who actually heart rates really, 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 really scary low, but it just means they're an athlete. And if their heart rate's really, really scary low and I didn't know it and I assess them, I'm thinking something's drastically wrong with this patient. But on having a baseline and understanding that we have that is his normal, and that's why we're trying to establish what is normal for most of the patients, for whoever we're taking those vital signs for. It is the nurse's responsibility to be able to interpret these vital signs and to know when an intervention is necessary, such as notifying the physician, medicating the patient, or altering any physical activity or prescribed for the patient. So it's not only nurses, we have also EMTs, we have paramedics, PAs, nurse practitioners, all these other medical professions who actually use these vital signs to make decisions on treatment or how to progress or what do I need to do. You're not there yet. I just want you to be aware of it. Um, so another thing we focus on is oxygen concentration in the hemoglobin of the arterial blood can be measured through a non-invasive technique called pulse oximetry. We actually call it most terms you'll hear it is post ox. That's what we all say, post ox. And it's actually this little machine. I don't have it with me right now. It's a little machine that it has infrared lighting, and what it does, you put it on the nail bed, and it measures the how much light is reflected back, and so it measures the hemoglobin and how much is reflecting back, and depending on that percentage is how we know how much oxygen you're actually carrying throughout your blood. And then the fifth sign is our pain. So we always want to ask about their pain, um, especially when you have a post-procedure or you're talking about EMS and you have somebody who has been in some kind of trauma. All right, let's start talking about the temperature. The temperature is a measure of the body heat. Heat is produced in the body by muscles and glands and by oxidation of food. So if somebody has more of that musculature body type, they're going to produce way more heat than somebody who's on the thinner side. Heat is lost from the body by perspiration, respiration, perspiration, and excretion. So these are the ways that your body will naturally try to cool you off. If you're really hot, first thing you're going to start doing is sweating. So that's one of the ways your body tries to regulate you. But it's one way that a lot of people do not think of, unless you're in a really, really cold environment, is your respiration. When you see your breath, you're actually losing heat through your breath. And excretion, if you're urinating all the time, you're going to lose some body heat through that way. The balance between the heat produced and the heat loss is the body temperature. if the body temperature is within the normal range, it is called afebrile. Okay, heads up, we use a lot of Latin terms. So febrile means temperature. Afebrile in Latin means without. So if without a temperature, that means you're within the normal range. So afebrile means normal range. And if you're febrile, that means you're abnormal. You actually have an elevated temperature. So if the temperature is elevated, it's usually considered 1 degree over the patient's norm. It is febrile. So here we go. We go into a little bit more classification. Temperature below normal is called hypothermia. For those who like to go camping and hunting, one of the things you're always trying to protect yourself from is hypothermia. And it's protecting yourself from your body going below your normal temperature, because it starts causing your body to start shutting down. Temperature above normal is called pyrexia. This is another term you just got to get used to. Pyrexia is you're above normal temp. Another abnormal condition, fever is not an illness. Having an actual fever is a symptom. It's not the cause, it's a symptom. It is an important part of the body's defense against infection. So most infections are sensitive to extreme heat, extreme temperatures, acidity, and that's most of drugs either temperature, extreme temperatures, acidity, base pH, extreme pH. Those are the main forms that we kind of attack diseases. So one of the ways your body naturally fights it is just pops up your fever. So you don't always want to treat those fever. So it helps fight that infection. Starts killing off that bacteria or virus that you don't even know you're having, but your body has already registered and say, okay, we got to do something about it. Many infants and children develop high fevers with minor viral illnesses. The older adults lose some thermoregulatory control, and an elevated temperature would not be the first presenting symptom of infection. When we start talking about older generation, as your body ages, your normal process slows down. One of the first things you start noticing versus a young kid and older is how slow they walk, how, they're just slow down. So does their immune system. So that's why you won't see them walking around with a fever like, oh my gosh, that he has a fever. He will have, the older gerontology patient will have an active infection and not present a fever. Most of the time, they could be completely asymptomatic and just catch it because they're not quite feeling right and they fall. And it's just a random event, and then maybe you can catch it. So that's why we have a lot of older generation of gerontology patients who are being succumbed by illnesses quicker than we anticipate. So while a fever signals that a battle might be going on in the body, a fever is fighting for the person, not against. So as you get older, you start losing that defense. So you become a little bit more immune compromised. Any other diseases can really take over as you get older. And most deaths are caused by the flu, just a simple flu to the older generation. The most common cause of fevers are abnormal conditions such as viral, flu, bacterial infection, bacterial meningitis. That's pretty mean. And it actually affects mostly teenagers, 20-year-olds, anybody who's going off to colleges. Colds or flu-like illness, sore throats, strep throats, ear infections, viral gastroenteritis, bacterial gastroenteritis, acute bronchitis, infections, mononucleosis. urinary tract infections, upper respiratory infections such as tonsillitis and laryngitis. Thermometers. So now that we know that we have body temperature that we have to regulate, now we need an instrument to actually measure that. There are several types. There is the glass, which is really old school, the oral, which means ear, temporal, which is the temple artery. It's the one I'm sure you all have seen. It's the one that scans across your head and measures the artery, the temperature on your artery and temporal. The chemical treated paper or the plastic thermometer, mostly for isolation, for people who are really infectious and you don't want to do cross-contamination. It's like a little sticker. Sometimes you use it on kids too. It's a little sticker and it kind of shows up the dots where is the temperature. And the electronic and digital ones, you've probably seen the one that you put under your mouth and it just beeps on you. The glass thermometer is used for home care. I don't even think we can find a glass thermometer. I don't think I can find a glass thermometer even if I tried. They've kind of been outdated because they have been known to break. So last thing you want to do is have a glass thermometer in your mouth and have it break. That's not safe, and considering we have new technology, that's not even worth the time. But it's hollow glass tube with calibration lines on it. The liquid in the glass is heat sensitive. It used to be mercury. Mercury is very heat sensitive. So, mercury, by the way, it is toxic. And back in the day, they had the glass thermometer, and they had mercury in it. So there was the potential of this glass thermometer breaking in your mouth with toxic mercury. So now you see why we moved away from it. This enables you to read the patient's temperature. The most common type of glass thermometers, believe it or not, there was oral thermometer and a rectal thermometer. The oral thermometer has a long, slender tip, and the rectal thermometer has a shorter, stubby, and rounded tip. Here's the oral. Makes sense? Long to put it underneath your tongue. In the rectal, you want to have a little bulb so it doesn't slide all the way through. It kind of keeps it secure. And the rectal is the most accurate temperature site. Okay, so the oral thermometer, which is your ear thermometer, is commonly used because it's accurate, fast, easy to use, and safe, and it's not super invasive. It is especially effective for babies and children. The probe from the oral thermometer is positioned in the oral canal of the ear. So you're going to have it in your ear. So if you have noticed, depending on the age of the child, if they're below 3, you pull, because of the way the ear canal is built, you pull down and you pull in the ear thermometer so you get straight shot into the tympanic membrane. If they're older, you pull up. Older than 3, you pull up. Some oral thermometers can take a temperature in just 1 second. Oral temperatures are commonly used in children. There's some questions about the accuracy, especially in children younger than 6. It's all about the ear eustachian tube, the ear canal. I'm sorry, not eustachian tube, the ear canal. If you don't get that lined up, you will get an inaccurate reading. So you'll be reading the sides of the walls of the ear canal, not just your tympanic membrane. The goal is to get the tympanic membrane. Liquid crystal thermometer. These are the 4 heads. They use heat-sensitive liquid crystal on a plastic strip that is applied to the forehead. These are the ones that we are using for the isolation patients. That way we can just put it on their forehead and monitor, see what color it is, if they're good. That way we are using it for just one person. It's not going to go from person to person. So if they have something that we don't want it spread around to everybody, we just keep it on them. And they just can wear it. It doesn't bother them. It's just simple, and it just changes colors on them. And it changes it based on the heat emitted from the surface of the skin. A liquid crystal thermometer can be used on children, babies, Also, isolation. The strip can be left on the forehead for a continuous update on temperature changes. Okay, so the chemically treated paper or plastic thermometers. This type of thermometer is read by noting its change in color is discarded after 1 use. Same thing. So the electronic and digital thermometers. This is the one everybody's more used to, especially at the hospitals where they have the actual machine and then they have the cord and then they have the tip, and the tip is covered with a plastic or a plastic sheath, a hard one or a soft one, and it just, you put it in someone's mouth or axillary and it's quick and you're able to use it multiple times for multiple people without cross-contamination. So different sites to take the body temperature. The oral is the simplest, most common, convenient, comfortable. It's the most frequent one. Rectal, unless it's a child or somebody, mostly just children, is the one you would do rectal. If you have a screaming kid is just screaming and will not stand still for you at all, but I would still go to the strip. But that is the most accurate body temperature way to measure the body temperature. The oral, the ear side is like the oral cavity. It's accurate and easy to use. The axillary is the least accurate temperature, and it is taken in the armpit. The pulse. The pulse is caused. Did I give you? I do not have. Let me make sure that you have temperature. No, I do not. The normal temperature, if anybody knows, normal temperature is 98.6. And that changes depending on the site. If you use temporal, it's going to go a little bit cooler. It'll probably be 97.6, more than likely 97 in that range. Oral, you might range from 97.6 to 98.6. Rectal will actually go a little bit higher and it will be 99.6. And that will be the normal for rectal because it's the closest and it's in closed cavity and it will have it will be warmer than the rest of the body. The axillary actually would be the coldest and it's going to run at 97.6, maybe even a little cooler, but that depends of where they're sweating. It's not completely accurate. Sorry. And the oral will be almost the same as temporal, 97.6 to 98.6. So the pulse is caused by the pressure of the blood pushing against the wall of an artery as the heart contracts and relaxes. So as your heart is pumping, it's pushing your pulse, it's creating your pulse. It is the throbbing of an artery as the human heart beats. So the pulse rate is an important vital sign because it indicates how well the blood is circulating through the body. When you check the pulse rate, you can count the number of beats in heartbeats in 1 minute. This is called beats per minute. Okay, let's back it up. If you know about the heart, when you go for a run and you're just working out, your heart starts pumping harder. As your heart works harder, your pulse will go up too because it's pushing out more. Now, if you're more in a relaxed state, your heart's not going to be working as hard, and then your heartbeat is going to be slower. So when you check, a good practice is to check for a whole minute, and we call it beats per minute. And a good practice, and we're going to talk about the different location. When you look for a location of where to take your pulse, here on the carotid, see, you find your trachea, your windpipe. You see all those bump and ridges come to the side with 2 fingers, and you should feel it bump, bump, bump on one side. Don't squeeze too hard. You don't want to pass out. Let's not. I don't think Mr. Henderson wanted to give anybody CPR. Or on, for babies, we do brachial. But for us, we're going to be focusing on the radial. Radial, look at your palm of your hand, okay? So I'm doing this backwards for you. The thumb, wherever the thumb comes down, and you find the radial bone, you'll find 2 bones here. There's a radial and an ulna. And right here is where your wrist meets the radial bone. There's a little notch. Don't push too hard. Just push gently and you will find a pulse. And it should be, yep, there you go. In a healthy person, your pulse will be the same everywhere. So not only can we take it at the radial section, we can take it at the femoral pulse, we could take it popliteal, posterior tib, or dorsalis pedis. These are different points that are needed in case you do, like, for example, if you hurt, let's say you broke your arm, your lower arm, it would be great to be able to tell if your hand is getting perfused, if there's blood in circulation to your hand, by taking a pulse. If you break your foot and there's no blood, if we can't find a dorsalis pedis pulse, we're going to start worrying that, you got to get into surgery. These are important for assessments in the future. Okay, so pulse characteristics. So not only do we want to count how many in a minute, we also want to know what is it like. Just counting the beats is not enough. It's important to observe the characteristic of the pulse. That means that you need to know rate. So the rate should be 60 to 80. Rhythm, is it regular? Is it irregular? Volume, is it full? Is it bounding? Is it weak? Is it thready? So if I am an irregular heartbeat is going to go boom, 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 boom. Versus a regular heartbeat, it'll just be continuous. Boom, 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 boom. An irregular will either skip beats, multiply beats, and there's some interesting rhythms that are, as you get further along in the course, you will discover that they're coming all flavors. So, alright, let's get back to the pulse rate. Generally increases with exercise, emotional excitement, hemorrhage, or elevated temperature. So your heart rate is going to go up for any of these conditions. Hemorrhage means when you bleed out a lot. So I'm talking about a good amount of blood. Also, drugs can increase or decrease the heart rate, and we use it to treat for those people who have irregular rhythms. When the rate is over 100 beats per minute, it is called tachycardia. When the rate is below 60 beats per minute, it is called bradycardia. Tachy means high, brady means low. When the rate is irregular, once again, here's some more Latin terms. See how this is arrhythmia? Arrhythmia means within the rhythm. Without a rhythm. So arrhythmia. Okay, so your radial pulse is the most common site for counting the pulse rate. This pulse is counted on your thumb side of the wrist. Do not use your thumb to count a pulse because you have a pulse in your thumb. Got it? Let me repeat that. Do not use your thumb. That's a no-no. Use your fingertips, your pointing finger and middle finger, lightly to feel it. Do not use your thumb. No thumb. Okay, so the apical pulse, this is like a little bit more advanced. We'll discuss it. You may be asked to count an apical pulse. This is a pulse counted at the apex of your heart. And so we're talking about down here where everybody kind of thinks where their stomach is, and to count the heart directly. That's where you get the best sound. You use a stethoscope. You need a stethoscope to listen directly over. It's 3 inches to the left of your sternum, just below the nipple of the chest, and so you're able to count it directly. Respiration. Okay, so that concludes. Let's conclude the pulse. Normal is 60 to 100. Got it? 60 to 100. Anything below 60, we're going to be worried about you. Anything above 100, we're going to be worried about you. With one condition, especially for those athletes have been known. They did a case study, I think in the 50s, where the Olympians, they were testing the Olympians between track meets. And they had this one particular guy, his name is escaping me right now, but his pulse, like he would run, do his track meet, get all worked up, normal, go up, tacky for a little bit, and then when he sat down, within a minute, his heart rate was down to like 40s, 30s. That right there is a trained body, tons of musculature and tons of cardiovascular training. So there are exceptions to this hard fast rule, but we would still classify him as bradycardic. So your respiration is the process of taking oxygen into the body and expelling carbon dioxide. So we take in the oxygen, we blow out carbon dioxide. When we count an one respiration is you breathe in, you breathe out. That's just one. You don't count in and then out. That's two. It is only one. When you count a patient's respiration, you do not want the patient to be aware of what you're doing. If the patient realizes that you're counting the respiration, he or she may not breathe normally. Yeah, when we all get on that spot and we kind of figure out, like, oh, they're doing this, sometimes you speed up or slow down. And the best way, one of the tricks of the trade, is when you're taking a pulse on a patient, you just go ahead and you hold on to that hand, pretend you're still taking the pulse, and start counting their respirations. That's the easiest way to try to get an accurate respiration count without having the patient knowing that you're doing it. So the pulse oximetry is a procedure used to determine the O2 saturation of arterial blood. Basically, layman's term, this is the pulse ox little machine that I was talking about earlier. They use this infrared light to check how much hemoglobin you have in your digits. So we're talking about fingers. We can do it ears, nose, toes, anything that we can get. But normal common sight is fingers. It is useful for monitoring patients at risk for hypoxia, a condition which the body or region of the body is deprived of adequate oxygen supply and postoperative. So very simple. Without air, you're gonna die. That's not an option. Air is not an option for us. So we are able to use the post-ox to figure out, oh, he's having trouble with having air supply. So the device that measures the oxygen in the blood is called a pulse oximeter. Blood oxygen content is an important indicator of patient's respiratory and cardiac condition. So respiratory characteristics. Age influence respiration. Yes. The rate of newborns may be 40 respiration per minute. So as as baby, as newborn, they have higher heart rate, higher respirations. They have they have to work a little bit more than we do as adults. So the normal suggested rate for respirations for an adult, teenager to adult, is 12 to 20. That's without exertion. So you're not working out, you're sitting, you may be reading, 12 to 20. That's what we expect. You haven't walked up the stairs. When you measure respiration, always note the following: the rate, the rhythm, the quality. If there's dyspnea, check it. Okay, we're not going to go into these big terms. Dyspnea is, okay, so the rate is going to be 12 to 20. Your rhythm, there, you're going to have some patient. I don't know if anybody has had experience with asthma. If you ever seen somebody with asthma, they're like, you're going to see a lot of shallow breathing, wheezing. That's common. So that's where you would be notating that. The quality, is it full? Where is my watch? And dyspnea is shortness of breath. Are they struggling to breathe? Or are they having like a full-blown panic attack? There will be tachypnea. And they would be like, almost to the point that they will pass out. And if they're not breathing at all, we call it apnea. This right here, that's not good. If you have apnea, that is not good. Cheyne-Stokes is 2-3 consecutive breaths and then a period of no breathing. So it'll go. So when somebody's at the end of life, a lot, or trauma, you normally see these Cheyne-Stokes rhythms. Or rails, rail sounds like, I don't know, it sounds wet. I will have to play some audio clips on that one for y'all, because I can't replicate that by myself. I'll have to find audio clips. Okay, so when you record the vital signs, so now you know that we need temperature, pulse, and respiration, and sometimes pulse ox. But we're not there yet. Always write the temperature, pulse, and respiration in the same order, TPR. It's just easy. Everybody's going to know what it is. We need consistency across the board. So since all the healthcare workers write the vital sign the same way, you do not need to do TPR above the figures. So if you are going to write the numbers, 98.6, 98.6, right here, 72 and 16, and you didn't write all of this, I would automatically know what it is, because my assumption is TPR. Taking vital signs may seem routine, but it's important about the information about the patient well-being. Careful recording for vital signs is essential for the protection of the patient. It's something very simple. It's something that if I have something going, like if I have a patient who changes on me and is not acting right, the first thing I'm going to start looking back is, what were their vital signs before he started acting funny? What is going on? I need to see where he's been before, what is his normal, and then what is changing. And it kind of gives me a hint of what I need to be addressing and assessing. Okay, that'll be it for today. Blood pressure hopefully will be next lecture, and hopefully I'm in class with you. I look forward to seeing you and spending some time with you guys. If you have any questions, probably directed to Miss Cozy, I will be in touch. Thank you.